All right, good morning, everybody. Today we're here with Steve. I really wanted Steve to share his story with you because it's quite an impressive story. The changes that we saw today when reviewing his blood work, as well as other biomarkers. So, Steve, how old are you?
56.
And do you have any general medical problems?
My thyroid is a big issue as well. It's a big issue.
You have a little bit of a slower thyroid, and you came here with a little bit of a slower thyroid issue, which we're monitoring and managing using desiccated thyroid. However, can you speak a little bit about your cardiovascular disease and the kind of numbers that you presented here with when you first came in? How long have you been here as a patient?
October last year, I believe.
I think it was the 2022, right?
Yeah.
So it's not even been 2 full years yet.
No, it's 15 months, I believe.
Yeah. And prior to coming to this practice, were you taking any kind of cholesterol medications or anything like
that? A statin, yeah.
You were on a statin. Are you
Yes.
still on a statin?
No, I am not.
You're off the statin.
Mm-hmm.
Wow, that's interesting. So let me just tell you a little bit about your numbers when you came here and where your numbers are today. So while cholesterol is important, what's more important than cholesterol are the particles that carry cholesterol. And one particle is called apolipoprotein B. And B we could just think of as being bad. So what it is, it's a carrier of all the bad cholesterol. And it's a major risk factor for heart disease because that ApoB sits on your blood vessel wall and creates plaque and has been linked in medical studies to heart disease and heart attacks and sudden death. So you came here with an apolipoprotein B way out of the normal range at 138, which by any standards is a very high number. Today, your ApoB is 87, so it markedly reduced, which means that you reversed heart disease because you got that under control. More importantly than that, however, was your lipoprotein A. And you know what lipoprotein A is.
Yeah, you explained it all.
Lipoprotein is a genetic risk for heart disease, and there's no drug on the market that lowers this lipoprotein A. And if you have a high LPA, you have a high chance of having a heart attack and heart disease. Your lipoprotein A was 313 when you came, and today it's 90. Unbelievable, because there's no drug on the market that lowers that. So the question today is, how was that all done? Like, how did this happen? What are you doing in your life to make this all possible?
The biggest thing for sure is when I was going on the TRT. That changed my whole life. It gave me changed my motivation. It changed everything. Just that drive that I didn't have before. The supplements that you guys are giving me have helped out tremendously. And then over time, just becoming more able to do the workouts that I never had the energy to do before. Now I can push myself to that next level to where I need to be. So the workouts have been great. My life has been great. Everything else on top of it because of that, it changed everything for me.
Yeah, that's all great. So let me tell the audience a little bit more about an objective test that we do in our practice. So when patients come to our office, we always do an in-body. An in-body is an objective way to look at your percent body fat, your skeletal muscle in pounds, your visceral fat. So we look at some of the more detailed body composition markers. And what was most interesting about you is that you were 250 pounds when you came in. You were 26% body fat, and you had about 98 pounds of muscle. Fast track forward today, you're down 13% body fat. You went from 26 to 13% body fat. Your weight dropped 25 pounds, and your muscle went up about 10 to 15 pounds on your skeletal muscle. So that marked shift in your metabolism, where really we shifted not only improving your lipids and your cardiovascular disease risk, but we really improved your health span and your lifespan by you getting your muscle up, your fat down, your insulin resistance is significantly better, and your testosterone numbers are now where they need to be at the optimum range. And you're doing this all off the statin, which is mind-boggling to the medical community because everybody, by every standards, every doctor would only have you on a statin because that's one size fits all. to fixing you. But here is proof that by using the bioidentical hormones that we have you on, the thyroid, the DHEA, the testosterone, alongside with the right supplements to address your cardiovascular health, like berberine, like nattokinase, like fish oil, like niacin, and you're living the lifestyle, you've really done everything to reverse aging. And that whole process is something that more and more people like yourself, your peers, other people age like your age, need to do more often in order to fix their health, instead of just using pills to treat diseases. And what we're doing here is we're really preventing diseases and improving your quality of life and health. So I really thank you.
Thank you for everything. You changed my life for sure. Yeah,
thank you.
Much better.
And we appreciate your trust in the process, and we appreciate you taking a few minutes to share this with the audience.
Of course, yeah, anytime.
Thank you.
Great. Thank you.